How do inflammatory cytokines or metabolic reprogramming of bone marrow, for example, bone marrow microenvironments, contribute to resistance in malignant myeloid clones?
That is a great question for sure. We know that during treatment with most of the therapies, including chemotherapy and venetoclax, there are critical alterations in the bone marrow microenvironment. More recently, we have heard about, even in this ASH, about basically adipose tissue changes in the bone marrow microenvironment, especially with FLT3 inhibitors. But also we know about fibroblasts and venetoclax and chemotherapy. So I'm pretty sure that those alterations change the cytokines and the interaction between the bone marrow microenvironment and the malignant cells. We do know that upregulation, increased secretion of IL-1B and TNF alpha in the bone marrow microenvironment is associated with chemotherapy resistance and most recently venetoclax resistance.
Mm. Is there evidence that inflammation-induced epigenetic remodeling creates a permissive state of resistance subclones to emerge or persist?
Yeah, of course. I mean, epigenetic alterations are key for in a number of those myeloid neoplasms, especially those that have specific mutations in genes such as DNMT3A, TET2. And in that setting, we know that epigenetic changes are also important. With regards to inflammatory signaling, it's a good question. I'm not aware of specific, impact of epigenetic alterations, but I'm pretty sure that that's the key.
To your knowledge, are there any specific particular myeloid cell subsets, such as monocytic progenitors, that are especially prone to inflammation-associated resistance dynamics?
For sure. We know that monocytic leukemias, M4, particularly M5 leukemias, appear to show significant activation of inflammatory signaling, including interferon gamma and TNF alpha. Most of these signals of activation are linked to exogenous signaling coming from natural killer cells, dendritic cells, and other cells in the bone marrow microenvironment. But definitely, I would think that monocytic leukemias are particularly inflammatory as a result of activation of these pathways. Yes,
Yeah.
they are prone to be.